Assalamualaikum and a very good day to Madam Asma Harun. I am Nur Afiqah binti Sukardi. Today I want to present about clinical case study with a title Dengue. Dengue is a viral infection transmitted to humans through a bite of infected mosquitoes. Approximately half of the global population is at risk, with an estimated 100 to 400 million infections occurring annually. Dengue, also known as breakbone fever, is most commonly found in tropical and subtropical regions, including Central and South America, Africa, part of Asia, and the Pacific Islands. While many people infected with dengue may not show symptoms, those who do not typically experience high fever, headache, body ache, nausea, and rash. Most individuals recover within 1 to 2 weeks. However, some develop severe dengue, which include symptoms such as abdominal pain, frequent vomiting, vomited blood, blood in the stool, nosebleed, bleeding gum, and extreme fatigue, restlessness, or irritability. Severe cases require hospitalization, as dengue can be fatal if not properly treated. Type of dengue virus. Dengue is not contagious and cannot be transmitted directly from person to person, except when passed from the pregnant woman to their child. Dengue fever occurs when a person is bitten by mosquito carrying one of the four types of dengue virus. Symptoms are usually mild during the first infection, but it is a person is infected again with a different strain of dengue virus, the risk of severe complication increase. The dengue virus exists in four distinct serotypes: dengue virus 1, dengue virus 2, dengue virus 3, and dengue virus 4. Transmission cycle of dengue. Dengue fever spread is the most common mosquito-borne viral disease in the world. The dengue virus is a single-stranded positive chain RNA virus belonging to the family Flaviviridae. It is transmitted through the bite of the infected female mosquito, primarily to the Aedes aegypti species and to the lesser extent Aedes albopictus. This mosquito also transmit chikungunya, Zika, and yellow fever virus. It started when mosquito bite and take blood from a person with acute dengue. Extrinsic incubation happened in mosquito body which virus infected the midgut and eventually traveled to the salivary gland. Then mosquito bite again the human and cause human infected this time. One mosquito can infect several humans. After that, intrinsic incubation happens in the human body. What happens in the body when dengue virus infected? Dengue fever is caused by one of the four dengue viruses. When it is infected, mosquito bites you, the virus enters your bloodstream and replicates. Both the virus and your immune system response can make you feel ill. The virus can damage the component of your blood that help form clot and maintain the structure of blood vessel. Additionally, chemical produced by your immune system can cause blood to leak from your vessel, leading to internal bleeding. This effect result in the life-threatening symptom associated with the several dengue. Prognosis or chance to recovery from infected by one dengue virus serotype provides temporary and partially cross immunity to the other serotypes, lasting only a few months. However, immunity to the same serotypes is lifelong. After being infected with one of the four dengue virus strains, you should not get the strain again. However, antibodies for that strain don't perfectly fit another dengue virus strain. Therefore, a person can be infected with dengue up to 4 times in their lifetime. Case presentation. Mr. M is a 27 years old male with 64 kilo weight and 164 height, Indonesian race and staying for 1 year at Malaysia. Worked in the grocery store with no significant past medical or surgical history. He present at the emergency department with the complaint of fever, headache, retroorbital pain, and myalgia for 1 week duration. The patient report on high-grade intermittent fever for the past 5 days accompanied with the rigor and chill, along with the warning signs such as rapid drop in platelet count, vomiting, and abdominal pain. He also stated that he had a lost appetite since got the fever and denied all activity in all high-risk behavior. No traveling, no COVID or TB contact, not come from the dengue area, and not taking outside food. Because of warning sign of the hemo concentration and plasma leakage into abdominal and lung with abdominal pain, he was warded into hospital. Upon his admission, laboratory pathology of Hospital Shah Alam had done several screening tests in his blood samples, including a full blood count FBC, renal profile, activated partial thromboplastin time, aspartate aminotransferase, blood culture and sensitivity, HIV, blood sperm malaria parasite, and rapid dengue IgG-IgM tests. Results show the baseline workup done in the emergency department was normal except for the low platelet count of 81,000 microliter and a low white blood cell count of 3.5 thousand microliter. Doctor will suspect several diseases when he sees on this result. Low platelet and white blood cell can lead to several diseases such as leukemia and other cancer. Some types of anemia, viral infection such as dengue, hepatitis C or HIV, heavy alcohol consumption and many more. Besides that, many studies state that dengue fever can cause low white blood cell count, known as leukopenia. Several studies have demonstrated a significant link between dengue infection and leukopenia because there are many possible disease that can be suffered by the patient, so the doctor suggests undergoing several laboratory tests to determine and to confirm the patient disease. Then the patient was admitted in the isolation ward with the suspicion of the dengue high fever, which was later confirmed on serological evidence with positive rapid dengue IgG and IgM, such as looks at the picture. Results show the patient activated partial thromboplastin time APTT. Result is elevated at 36.2 seconds compared to the normal range of 25 to 35 seconds. This can be caused by the either reduced synthesis of the increased consumption of specific clotting factor. In dengue, a prolonged APTT along suggests a defect in the intrinsic coagulation pathway. An imbalance between coagulation and fibrinolysis may lead to hemorrhage in dengue hemorrhage fever or dengue shock syndrome. Results show the patient aspartate aminotransferase AST result is elevated at 361 microliter, which is above the normal range. The AST test measured the level of the aspartate aminotransferase in the blood to assess the liver damage. AST is the enzyme produced by the liver. It is reported that approximately 75 to 80% of dengue patients have abnormal AST level. The liver is more commonly affected by dengue than the other organs. All the test results show negative result in blood culture and sensitivity, HIV test, and BFMP malaria test. Because of the dengue kit is a positive, confirmation test for subtype dengue was done after that. After a week, the patient results have been released as shown in picture. Patient blood results show dengue 2 detected, which means it's a positive for subtype dengue virus 2. This virus belongs to the family Flaviviridae and the genus of Flavivirus. Conclusion. The patient was confirmed positive for dengue with a dengue serotype dengue virus 2 confirmation test. Currently, there is no specific antiviral treatment for dengue virus including dengue virus 2. Management of dengue fever primarily involves supporting care to alleviate symptoms and prevent complications. The several key aspects of treatment are explained to the patient, such as encourage to drink plenty of fluid or water. Electrolyte solution, intravenous IV fluid may be necessary to maintain adequate fluid balance and prevent shock. If patient is having fever, paracetamol is recommended to manage fever and pain. Get adequate rest is essential to support the body's recovery process. Patient also should be regularly monitored for warning signs of severe dengue, such as abdominal pain, persistent vomiting, rapid breathing, bleeding gum, fatigue, restlessness, and blood in vomit or stool until he recovers. This is my references. Also another my references. Then thank you for listening.